Congenital heart disease. What parents need to know. Welcome to the U.S. Health Guide, your channel for reliable, easy-to-understand health information that empowers you to make informed decisions for your family. Today, we're diving into a crucial topic: congenital heart disease. Congenital heart disease, CHD, is a complex yet increasingly understood medical condition affecting a child's heart structure from birth. The term congenital simply means present at birth. These abnormalities arise when the heart or major blood vessels do not form correctly during early pregnancy, specifically within the critical first 6 weeks of fetal heart development. CHD can involve issues with the heart's arteries, valves, chambers, or the walls separating them, all of which can impact the proper flow of blood and oxygen to the lungs and body. While some congenital heart defects may be simple and require no treatment, others are more complex and can pose life-threatening complications if not managed promptly. It is crucial to understand that CHD is the most common type of birth defect. In the United States, an estimated out of every children, or approximately infants annually, are born with a heart defect. This figure signifies that CHD is not a rare anomaly, but a significant public health challenge, impacting numerous families and necessitating widespread awareness and robust support systems. However, a critical message to convey is that significant advancements in research and treatment have dramatically transformed the outlook for children with CHD. Today, over % of individuals born with heart defects in developed countries live to adulthood. This means many children with these conditions are now living full, active, and healthy lives well into adulthood. This shift from a historically grim prognosis to a more hopeful future underscores the need for accurate information and support for parents navigating this journey. The journey begins: how and why CHD develops. Fetal heart development is an intricate and delicate process. A baby's heart begins to form and beat during the first 6 weeks of pregnancy, a critical period during which major blood vessels to and from the heart also begin to develop. It is during this crucial time in a baby's development that congenital heart defects may begin to emerge if these structures do not form correctly. Researchers remain uncertain about what causes most types of congenital heart defects, with only about -% of cases linked to known genetic conditions. However, it is believed that the majority of CHD cases result from a complex interplay of gene changes, certain maternal health conditions, environmental exposures, and lifestyle factors. There are several identified risk factors that parents should be aware of. Congenital heart defects appear to run in families, indicating an inherited component. Changes in genes have been linked to heart problems present at birth. For instance, people with Down syndrome are often born with heart conditions. The growing understanding that genetic variants are responsible for nearly 1/3 of congenital heart defect cases suggests a shift in comprehending the biological underpinnings of CHD, moving beyond purely environmental factors. Having certain infections like rubella, German measles, during pregnancy can cause changes in a baby's heart development. A vaccine is available for those who are not immune, highlighting the importance of pre-pregnancy vaccination. Maternal health conditions also play a role. Careful control of blood sugar before and during pregnancy can reduce the risk of congenital heart defects in the baby for diabetic mothers. It is important to differentiate between pre-existing type or type diabetes and gestational diabetes, as gestational diabetes generally does not increase a baby's risk of heart defects. Maternal obesity may also raise the risk of having a baby with CHD. Taking specific medicines during pregnancy can cause congenital heart disease and other health problems present at birth. Medicines linked to CHD include lithium for bipolar disorder and isotretinoin used to treat acne. This underscores the absolute importance of always informing the healthcare team about all medicines being taken, including over-the-counter drugs and supplements, both before and during pregnancy. Lifestyle factors also have an impact. Drinking alcohol during pregnancy increases the risk of congenital heart defects in the baby. Similarly, smoking during pregnancy also significantly increases the risk of congenital heart defects in the baby. Quitting is advised. While not all cases of CHD are preventable, parents can take important steps to reduce known risks. This includes ensuring good blood sugar control for diabetic mothers, avoiding alcohol and smoking, and discussing all medications with a healthcare team before and during pregnancy. The fact that the fetal heart forms in the first 6 weeks of pregnancy, often before a woman knows she is pregnant, emphasizes the critical importance of preconception health and pregnancy planning. This means a woman's health before conception and in the very early stages of pregnancy is profoundly significant for fetal heart development. Common categories of congenital heart defects help parents better understand the diverse nature of this condition. Some defects involve holes in the heart, which are abnormal openings in the heart walls that allow blood to mix between chambers. Common examples include atrial septal defect, ASD, ventricular septal defect, VSD, and patent ductus arteriosus, PDA. Another category is valve problems, where heart valves, which control blood flow, are narrowed, leaky, or improperly formed. This can include aortic valve stenosis, pulmonic stenosis, bicuspid aortic valve, BAV, and tricuspid atresia. Furthermore, there are vessel abnormalities, where major blood vessels to and from the heart are narrowed, misplaced, or have abnormal connections. Typical examples are coarctation of the aorta, transposition of the great arteries, and truncus arteriosus. Some cases involve underdeveloped heart structures, meaning a part of the heart does not develop properly, affecting its ability to pump blood. Hypoplastic left heart syndrome, HLHS, and pulmonary atresia are examples of this type. Finally, there are complex defects, which are a combination of multiple structural heart problems simultaneously, with tetralogy of Fallot being a prominent example. Spotting the signs, symptoms parents should know. The symptoms of congenital heart disease vary widely and depend on many factors, such as the type, number, and severity of the heart defect, as well as the child's age. Some simple defects may cause no symptoms at all, while serious defects are often detected prenatally or soon after a child is born. Less serious ones may go undiagnosed until later childhood or even into adulthood. It is important to note that symptoms can also return years after a heart defect has been treated. Here are the key symptoms to watch for, categorized by age. In newborns and infants, parents might observe several notable signs. One of the most critical is cyanosis, a pale gray or bluish discoloration of the skin, lips, or fingernails, indicating low oxygen levels. Babies may experience feeding difficulties and poor weight gain, tiring easily during feeding, leading to rapid breathing or shortness of breath, and consequently, poor weight gain. They might feed weakly, tire quickly, and sweat excessively during feeding. Rapid or troubled breathing is also a common sign, with an increased rate or effort of breathing, or shortness of breath, fast and labored breathing, and flaring nostrils. Lastly, infants might exhibit excessive sleepiness or fatigue, being unusually tired, less active, and sleeping excessively. In older children and adults, symptoms can differ slightly. Individuals may experience easy tiring or fatigue, getting unusually tired or out of breath easily during exercise or activity, quickly becoming fatigued during play, and unable to keep up with peers. Shortness of breath, especially during physical activity, such as getting out of breath when climbing stairs or running, is another indicator. Swelling, edema in the hands, ankles, feet, or stomach due to fluid collection can also occur. Irregular heartbeats, arrhythmias, a feeling of the heart racing or skipping beats is another symptom to watch for. Finally, chest pain or fainting are less common but serious signs that require immediate medical attention. Another common sign a pediatrician might notice during a checkup is a heart murmur. A heart murmur is a swishing sound heard when listening to the heart. While some murmurs can indicate abnormal blood flow due to a defect, many are innocent and do not signify a serious problem. Nevertheless, it is important for a doctor to check them out thoroughly to rule out any underlying issues. Parents should seek medical attention if they observe any of these symptoms, especially if they are persistent or severe. Early detection is key to effective management. The fact that symptoms can be subtle or appear much later in life suggests that continuous vigilance by parents and regular pediatric checkups are crucial, even if initial screenings are clear. This highlights the role of parents as the first line of defense in recognizing potential signs. The path to diagnosis, what to expect. The diagnosis of congenital heart disease is a multi-step process, often beginning before the baby is born and continuing after birth. The goal is to accurately identify the defect so that the best possible care plan can be established. Prenatal detection methods. Many cases of CHD can be suspected during routine pregnancy ultrasound scans. When a concern arises, a specialized ultrasound technique called fetal echocardiography is performed, typically around 2 weeks of pregnancy. This non-invasive technique uses sound waves to create detailed images of the baby's heart structure and function while still in the womb. Fetal echocardiography is particularly helpful if a routine scan suggests a problem or if there is an increased risk due to family history or other factors. Prenatal diagnosis offers significant benefits, allowing families and the healthcare team to plan for the baby's birth and immediate postnatal care. Postnatal screening and initial diagnosis. Some heart defects are evident shortly after birth due to characteristic signs like cyanosis or troubled breathing. During the newborn physical examination, a doctor will observe the baby, feel their pulse, and listen to their heart with a stethoscope, sometimes picking up heart murmurs. Another important screening method is pulse oximetry screening. This is a simple, painless test using sensors on the baby's fingers or toes to check oxygen levels, often performed to screen for critical CHDs before hospital discharge. Confirmatory and detailed diagnostic tests. If CHD is suspected, more in-depth tests will be performed to confirm and characterize the defect. Echocardiogram is the primary non-invasive test, using sound waves to create moving images of the heart, allowing doctors to visualize its structure, function, and blood flow. This test is often supervised by a pediatric cardiologist. An electrocardiogram, ECG, measures the heart's electrical activity to detect abnormal rhythms or signs of heart strain. A chest X-ray can show if the heart is larger than normal or if there is an excess amount of blood in the lungs, both of which can be signs of heart disease. Cardiac catheterization is a more invasive procedure where a thin, flexible tube, catheter, is inserted into a blood vessel, usually in the groin, and guided to the heart with the help of X-ray imaging. This procedure allows for detailed measurements of pressures and blood flow within the heart chambers and vessels, and can also be used for angiograms, dye injection for X-ray imaging. The evolution of diagnostic methods, from routine obstetric sonograms to specialized fetal echocardiography and postnatal pulse oximetry screening, has significantly improved the ability to detect CHD early and accurately. This allows for the diagnosis of over % of significant CHDs, especially critical ones, before birth. This precise and timely diagnosis not only helps families prepare, but also facilitates targeted management and care, leading to better outcomes for children. This complex diagnostic process necessitates an interdisciplinary collaboration of medical professionals, including obstetricians, neonatologists, and pediatric cardiologists, ensuring comprehensive evaluation and optimal care planning. Treatment options, a tailored approach. The treatment for congenital heart disease is highly individualized depending on the specific type and severity of the defect, as well as the child's age and overall health. It is important to note that some mild defects may not require immediate treatment or may even close on their own over time. Treatment options span a wide spectrum, from non-invasive management to complex procedures. In non-invasive management, for relatively minor heart defects, doctors may recommend only careful monitoring through occasional checkups to ensure the condition does not worsen. Medications can also be used to manage symptoms or complications, or to help the heart work more efficiently. Examples include blood pressure drugs, diuretics, water pills that help remove excess fluid from the body, and heart rhythm medications. For interventional procedures, also known as catheter-based treatments, these are less invasive alternatives to open heart surgery for certain defects. A thin tube, catheter, is inserted into a blood vessel, often in the groin, and guided to the heart using X-ray imaging. Tiny tools are then threaded through the catheter to repair the defect, such as closing holes in the heart or opening narrowed valves. Some catheter treatments may require multiple steps over a period of several years. Regarding surgical options, for more severe or complex defects, open heart surgery or minimally invasive heart surgery may be necessary, depending on the specific defect. In very severe situations where a heart defect cannot be repaired, a heart transplant may be an option. Finally, in very specific and rare situations, a procedure might be performed on the baby while still in the womb to fix a serious defect or prevent complications as the baby grows during pregnancy, known as fetal cardiac intervention. This broad spectrum of treatment options reflects the inherent diversity and complexity of CHD itself. This means parents should understand that there is no one-size-fits-all treatment, and their child's care plan will be highly personalized and likely evolve over time. Advances in diagnosis and treatment, particularly catheter-based techniques, have significantly improved outcomes for children with CHD. These technological advancements have made procedures less invasive, more precise, and available to a wider range of patients, offering a hopeful future for those with CHD. Living with CHD, lifelong care and support. One of the most crucial aspects of congenital heart disease is that it often requires lifelong care, even if a defect was successfully treated in childhood. Childhood treatment is often not a cure. Symptoms can reappear, or complications can develop years after initial treatment, due to factors like scar tissue from surgeries or the heart working harder over time. Therefore, regular checkups with a cardiologist specializing in congenital heart disease, rather than just a general family doctor, are essential. This perspective underscores that CHD is a chronic condition requiring continuous specialized management. Individuals living with congenital heart disease may face several long-term health considerations. Cardiac complications include irregular heartbeats, arrhythmias, heart failure, where the heart cannot pump enough blood to meet the body's needs, pulmonary hypertension, high blood pressure in the lung arteries, and an increased risk of stroke. Additionally, there is an increased risk of infection, particularly endocarditis, infection of the lining of the heart and heart valves. Good dental hygiene and discussing antibiotics with doctors before dental procedures are crucial to prevent this infection. Other organ systems can also be affected, with the potential for kidney disease, liver disease, and speech issues. Finally, individuals with CHD are at risk for challenges with neurological development, learning, emotions, and behaviors across their lifespan. This indicates that effective care for CHD patients must be holistic and multidisciplinary, addressing not only cardiac health, but also cognitive, emotional, and physical development. To support long-term heart health, adopting a heart-healthy lifestyle is recommended. This includes prioritizing a healthy diet, such as a plant-based diet or the Mediterranean diet. Maintaining daily physical activity is vital, but parents should always discuss appropriate activity levels and any potential restrictions with their cardiologist. Stress management and adequate sleep are also crucial. Practice stress management techniques, get enough sleep, and avoid smoking and excessive alcohol. There are special considerations for individuals with CHD. For women with CHD, pregnancy can put added strain on the heart. It is crucial to consult with a cardiologist specializing in congenital heart disease before and during pregnancy to ensure safety for both mother and baby. As children with CHD grow into adults, transitioning from pediatric to adult congenital heart care is a specialized and important field. The emphasis that childhood treatment is not a cure and that lifelong follow-up care is important represents a fundamental shift in understanding CHD. This is not a condition that is fixed and then forgotten. It is a chronic condition requiring continuous management. This implies that healthcare systems need to adapt to support adult congenital heart programs, and patients' families need education on this long-term perspective. Complications such as arrhythmias, heart failure, stroke, and neurodevelopmental issues are not just immediate risks, but ongoing challenges that necessitate specialized, integrated care throughout the lifespan. Resources for families: where to find help. Facing a diagnosis of congenital heart disease can be a daunting experience for parents. However, it is crucial to know that no one has to navigate this journey alone. There are numerous reputable organizations and support groups dedicated to assisting families affected by CHD. Reliable resources include the American Heart Association, AHA, which offers information on risks, symptoms, treatment, and specific types of defects. The Children's Heart Foundation funds research to advance the diagnosis, treatment, and prevention of CHD. The Adult Congenital Heart Association, ACHA, provides education and support specifically for adults with CHD and their families, focusing on long-term needs. Mended Little Hearts, part of the Mended Hearts organization, provides peer-to-peer support, education, and advocacy for children with CHD and their families. Conquering CHD works to improve quality and outcomes through education, support, research, and awareness. The National Heart, Lung, and Blood Institute, NHLBI, offers a comprehensive overview of CHD. Finally, the Centers for Disease Control and Prevention, CDC, provides fact sheets and information on prevention and diagnosis. The sheer volume and variety of these organizations indicate a robust support ecosystem for CHD families. These organizations offer education and support services, information about the effects of and risks, and peer-to-peer support. This highlights that access to reliable, understandable information and emotional support is crucial for parents navigating a CHD diagnosis. By providing these resources, the report empowers parents to become informed advocates for their children, reducing feelings of isolation and helplessness, and enabling them to make better decisions in partnership with their medical team. Conclusion: a future of hope. Congenital heart disease is a complex medical condition, but the remarkable advancements in diagnosis and treatment have brought about an increasingly positive future for children affected by it. Today, children born with CHD have a significantly greater chance of living full, active, and healthy lives into adulthood. For parents, it is important to remember that resilience, the strength of family, and the dedication of the medical community are key factors in this journey. Stay informed, partner closely with your child's healthcare team, and utilize the available support networks. With the right care and ongoing support, children with congenital heart disease can look forward to a bright and promising future.